Okay, before I jump into the video that I literally just recorded, I completely forgot that I wanted to show this little clip here. Came into shift for the night, and this is what I walked into. So that was nice to walk into. In a time where the pandemic is running rampant, people are getting very tired very quickly. That was very much appreciated. So those little thank yous to the healthcare workers, thank you to the nurses and doctors, they really do go a long way. So thank you guys for thanking us. All I want to do is just try to make people better. So let's get on with the regular video, and we'll see why it was such a welcome into work. Okay, alright, I'll admit it, this is all a complete overdue just so I can make the thumbnail. So let's start de-PPEing. Goggles for eye protection. My company was nice enough to give those to us. Reusable stethoscope. De-oxygen. What do you call it? Not de-oxygen. De-surgical mask. And I'm a little overheated, so we're going to get rid of this. Alright, anyway. I think there's someone else in the doctor's lounge who's going to trying to do this a little awkward. Where am I at? I'm at the end of a 2-week strain, 1 week of days, 1 week of nights, helping to deal with this COVID crisis. And I know that the last 2 videos were, I know this is going to come up like sort of a little, the timeline is going to be a little off. So I get that part of it. But the other 2 I did film last week when I was on day shift, as everything was starting to ramp up. So now that I've had a week of days and a week of nights to deal with this COVID pandemic, I thought it'd be nice to kind of sit down and reflect on all of that and talk about everything that we've seen. So I know the last video I posted, I had 1 patient who was COVID positive. After dealing with everything for the past couple of weeks, I brought my total up to about 4 people. Not about 4, I brought my total up to 4 people who were positive. And they all had varying ranges of severity of illness, and they all have varying ranges of prognosis. I had 2 people expire from COVID. The 1 patient didn't see it coming. The 2nd patient wanted to be DNR, DNI, didn't really want much done, so passed peacefully at the patient's request. 3rd one, very mild disease, but is expected to make a full recovery. 4th one, I swear was going to pass away. Sorry, there were other people in the lounge. I didn't want to make the video and have anybody else hear it. Anyway, so the 4th person I thought was going to die. Ventilator-dependent respiratory failure, but has actually made a very good recovery and is now back on nasal cannula doing much better. Went into full-blown renal failure, had renal recovery and everything. So it's been an experience. It has been tough at times. It has been, I don't want to say triumphant at times, because I didn't have I'm not an ICU doc, so I didn't have anyone who was doing poorly who got better. It's just been physically and emotionally draining dealing with all of this. It was fun in the beginning because I was learning so much as the pandemic was developing, as we learned new things about the viruses and the treatments and what was working and what wasn't working, how the virus now has this biphasic infection where you're okay after the first phase, but then you crap the bed sort of really quickly. All of those things were fun to learn on the journey. Now that we know a little bit more, now that everything is kind of, I don't want to say normalizing, but it is kind of normalizing. We have protocols in place now. We're dealing with all of it like we're supposed to. It's still very draining. I don't think I ever thought when I signed up for this that I would, I never thought when I signed up to be a physician that I would see so much death in such a short period of time. Not only am I having people expire from COVID, I'm having people expire from other things. I had 1 day which really just drained me, where I had 2 people, my 2 COVID people were not doing well. The 1 expired, and then another one of my patients, they coded with a GI bleed after bacteremia infection, and just watched this patient decline day and day and day, and then just all of it at once. I've never seen so many people do so poorly in a very short period of time. There were times where I felt very defeated, like I wasn't making any kind of a difference, because everybody was either so bad off and weren't going to get better, or they were just kind of and they just stayed that way, or they were doing fine and we just had to keep an eye on them. It was very reassuring to watch the number of rule-out cases come back negative, but it's just very draining, especially sitting here knowing that we're not even anywhere near being done with this, where we're expecting the next peak to come, especially in Las Vegas and in Nevada. We are expecting our peak in diagnoses to be on April 15th. It's currently only about April 10th, and so that's coming, with the death rate to skyrocket after that. So I don't even know right now. It's been horrible for people that I thought were going to do well to completely pass away and go the other direction, to, oh, it's just been a rough ride. I'm thankful that the couple people that I was taking care of did get better. But watching people who I thought were going to do well expire, watching families not be able to come in and see their loved ones, to even today where I had a patient earlier not doing very well, and they called a rapid response and they were like, what do you want to do? And I had all these things that I wanted to do, but they were like, you know, the patient actually doesn't want it done, doesn't want anything done, didn't DNR, DNI, which was very respectful, but then they wanted nothing else. And I was like, well, okay, why can't we do any of this stuff? You know, even though he's a COVID rule out, that doesn't mean you can't treat the people. And then they were like, nope, patient has already made up their mind, they don't want anything done, they've called their spouse, they've said goodbye, and we're just gonna let them pass. And if that doesn't break your heart, I don't know what does. After seeing so many people do so poorly from this, to not being able to see friends and family in the hospital, to expiring with a phone call to your spouse. As much as you want to try and maintain an objective composure with all of this and say, you know, it's medicine, this is what we're dealing with, little things like that still don't ever become normal. And they don't ever become any easier when those kinds of things happen to you or your patients. And it makes you take a whole different look at the ones that you love, and your family, your parents, and your siblings, and your aunts and uncles, if you have a huge extended family. But even just realizing how lucky I have it with everything, for all my family to be super healthy, for my parents to be doing well in their isolated little house in the woods, so they stay there and they don't move, to realizing that I'm the biggest threat to me and my fiance right now, because I could be bringing whatever home. It's scary. And people aren't listening to the orders to stay home. People are still going out, they're hanging out with their friends, they want to go to the supermarket, which you need to do. People are now arguing that churches should be open for Easter. And it's just like, if you could see what I see, if you could go through what I go through with my nursing staff every day, where we see the amount of people that are dying, where we see the people that have to call their spouse goodbye because you can't come and see them, you would think differently about this. And I don't understand how people can be so selfish when we're trying to get this together. I guess that's my little soapbox on that, but it's been rough. I'm exhausted from it all. I'm tired of all of the death. And I want this to be over, and I want people to get better. I think we're doing okay. I think we're going to keep pushing through. I think we're going to learn about the virus along the way, which is fascinating for me. And we're just going to keep going with it. So I'm very happy I'm at the end of my 2-week stretch. I'm very happy that I am going to just take a couple of days of a break, go home, be with my fiance, be with my 2 dogs, and just enjoy our lives and just go into isolation for a little bit. I want to be isolated. I want to be on my couch. I don't want to do anything. And that's what I'm going to do. So I might post some other, I think, travel videos that I've filmed along the way. But I'm taking a COVID break for a while because I'm tired. Not because I'm tired, because my shifts are over. I've thought about doing emergency work in like New York or going somewhere like that, but they're not really in need of hospital doctors. They're in need of intensivists, and unfortunately that's not me. They're in need of nursing staff. They're in need of everything they can possibly get their hands on to deal with this. So that's just, I'm just going to kind of have to wait this out. So again, it's devastating. Please stay home. Please stop endangering yourselves and others. If not for you, for the people that I see that are Medicare, that are older, that are dying alone in a hospital room, not at home with their loved ones, not being able for their loved ones to even come see them, because I don't want to risk getting them infected. And it's just, if that doesn't sit well with you, if that doesn't like make you want to stay home, I have no other words. The virus diagnoses aren't going to get worse because we're testing more. The death toll isn't going to go up because we're testing more. The infection rate and the death rate is going to go up because this virus kills people. That is what you need to take away from everything. And I'm off my soapbox again. So at the end of the week, at the end of the dealing with the COVIDs, that's it. That's it. It's tough. And I really hope it pulls together soon. I really hope that this gets over. But that's all I can do. I'm tired. What is it right now? I think it's 3 in the morning. I got 4 more hours. It's about 3. Got 4 more hours of my shift left. And then I'm just going to go decompress and deal with this. So, anyway, any COVID-related questions, please post it, comments below. And we will go from there. Please like this video, subscribe for more updates for COVID and travel or whatever. And I'll leave you guys to that. Alright, thank you for tuning in again, and I'll see you guys next time.